In this video, we are going to discuss CPR for a child or an adult. That's anybody over the age of 1. Step number 1 is check responsiveness. Hey, are you okay? Hey, are you okay? If this patient has no response, we want to tell somebody, hey you, call 911 and get an AED. Once they are on their way to call 911 and get an AED, we want to perform a vital check. It's 3 things. Look at the chest for a rise. Listen for a breath in the mouth, putting your ear next to their mouth. And feel, using the index and middle finger at the carotid artery. I want to do all 3 of these things at the same time for about 5 to 10 seconds. Once I have determined what vitals this athlete or patient does or does not have, is going to tell me what I need to do next. Avenue number 1, this person has a pulse and is breathing. Obviously they are unresponsive, so I'm going to wait for 911 to arrive for further medical attention. Avenue number 2, this person has no pulse and no breathing, meaning I'm going to do full CPR, compressions and breaths. Avenue number 3, this person has a pulse but is not breathing. I am just going to do rescue breathing for this patient. Now I'm going to go into step 4, which is starting CPR. Step number 4 is 30 compressions. I want to draw 2 imaginary lines, one across the nipple line, one down the center of the body. I'm going to find that spot where they intersect, put the palm of my hand there, other hand on top, interlock the fingers, straighten out the elbows, shoulders directly over top, and I'm going to perform 30 compressions at a 2-inch depth at a rate of 100 to 120 compressions per minute, or approximately 2 per second. Ready, set, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now I'm going to move on to step number 5, which is giving this patient 2 rescue breaths. I'm going to pinch their nose so air doesn't release out their nose. I'm going to take the back side of the same hand, rest on their forehead, perform a head tilt, chin lift. I'm trying to lift the chin towards the ceiling. I'm going to put my mouth over their mouth, creating a good seal, and I'm going to give them 2 breaths, looking to make sure they come in by seeing that chest fully rise. Once you see a chest rise, that is considered a good breath. Step number 6 is we are going to take 30 compressions and 2 breaths, which is considered 1 cycle of CPR, and we're going to perform that 5 times. So I'm going to do 5 cycles of CPR, then I'm going to move back into checking vitals. These are the steps that I'm going to do throughout the rest of this time until 911 or somebody else that is CPR certified can come to take over for me. During adult or child CPR, so anybody over the age of 1, if our vital sign check determines that the person has a pulse but is not breathing, we do not need to do full CPR. We only need to do rescue breaths. So we can skip the compression section of this and we can move straight into giving this person breaths. We want to pinch their nose. Using the back side of our hand, we want to tilt the head back and tilt the chin up towards the ceiling. So we want to do a pinch the nose, head tilt, chin lift. I want to get my mouth over their mouth and get a good seal while looking at the chest for a rise and fall every time I give them a breath. Now, unlike CPR, I'm going to give them 1 breath every 5 seconds. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Right now we're going to go over the use of an automated external defibrillator, or AED. There's only 3 steps to this, and it is turn on the AED, open it up, and follow the AED prompts.
Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing. Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR. Push harder. Good compressions.
Hey, today we're going to talk about an AED, or automated external defibrillator. This device can shock an abnormal heart rhythm back into rhythm. So if somebody is experiencing cardiac arrest, we want to get this on them as soon as possible. If we get to a patient that is under cardiac arrest and we don't have an AED available, we want to send somebody for an AED, and when they get back with the AED, we want to immediately put it on the patient because this doubles the chance of survival. Inside of the AED has a bag with some supplies that I want to discuss. First supply is a pair of scissors. We can use these scissors to cut the person's shirt or jersey off because we want the pads of the AED to be directly on the person's skin. The second thing in the bag is a rag. We can use the rag to wipe down any sweaty area or water that might be on them so that the pads can stick properly. The third thing is a razor. If somebody had a very hairy chest, we can shave the portions where the pads would go, so that way again the pads can stick properly. The fourth thing in the bag is going to be a CPR shield. This is a little shield that we can actually put over the patient's mouth, and this is going to be for your protection. It has a one-way filter that we want to put directly over the mouth, and it has guards that go over the ear to keep the mask in place. We can then do our mouth-to-mouth breathing over this mask to let air go in, but nothing to come back towards us. Again, this is going to save somebody's life, so we want to ideally get it to them as fast as possible. And again, it's going to double the chance of survival. During 2 rescue or CPR, or BLS, basic life support, you're going to have one person on the side to perform compressions and one person on the head to perform breaths. How to perform breaths, we're going to use this bag valve mask. We're going to put the mask part over the person's nose and mouth. And I'm going to perform what I like to call a C and E technique. The C is going to go across the mask to push this side of the mask down and seal it. The E is going to be used to grab the jawline and perform a head tilt. I'm going to take the bag itself and push downward on this side to actually seal this side of the mask. Then I'm going to squeeze this bag to perform 2 rescue breaths. Just like any other CPR situation, we're going to start with compressions. At 30 compressions, at a 2-inch depth, at a rate of 100 to 120 compressions per minute. After they have performed their 30 compressions, I'm going to perform 2 rescue breaths using the bag valve mask. We would continue 5 cycles of CPR just like normal. Here are the differences when performing CPR for an infant or somebody under the age of 1. We still want to check responsiveness. Hey, are you okay? Hey, are you okay? We then want to tell somebody to call 911 and get an AED. Call 911, get an AED. When we perform our vital check, we will still be using a look, listen, feel technique. We'll be looking at the chest for rise and fall. I'll be listening to their mouth for a breath, but I will be feeling for a pulse, still using my index and middle finger, but inside the bicep. I still want to be doing all 3 of these things for about 5 to 10 seconds. The 3 avenues that you could potentially see still are in play. When we start actually performing the CPR process, I do still want to draw 2 imaginary lines, one across the nipple line, one down the center of the body. But instead of using 2 hands for CPR, I'm going to be using 2 fingers for CPR. I still want to perform 30 compressions, but at a rate of 100 to 120 compressions per minute still, but at a depth of 1.5 inches instead of 2. When I transfer over to give this infant breaths, rescue breaths, I still want to do a head tilt chin lift, but I'm going to be putting my mouth over the mouth and nose of the infant to perform my 2 breaths. I still want to perform 5 cycles of CPR. 1 cycle consists of 30 compressions and 2 breaths, followed by rechecking the vitals.